We started LifeLength back in 2010 as a spinoff of the Spanish National Cancer Research Institute. And the company was able to set up its own laboratories in 2014. We became Spain's only U.S. CLIA accredited laboratory in 2016. And that same year, we achieved a number of other clinical accreditations. And we actually are the most accredited clinical laboratory in Spain. We are accredited in about 65 countries around the world, of course, including Canada. And we are, I would say, the world leader in the space of telomere diagnostics for clinical use. And that encompasses everything from working with physicians and medical professionals like yourself, in the fields of preventative and personalized medicine, concierge medicine. People are interested in understanding how to maximize not only their lifespan, but their health span, understanding longevity, how the aging process is working, but also working with many pharmaceutical companies and manufacturers of supplements and nutraceuticals who want to understand how a particular drug or a particular vitamin may or may not help in terms of cellular health. So we do a lot of studies in that sector. And increasingly, we're working to use our technologies, which are proprietary assays that we've developed for prognosis, diagnosis of many different types of cancer, starting with prostate cancer and hopefully soon with lung cancer.
That's important to me, is bridging the gap between diagnostics, so you get the results, and the, what's the gold standard in treatment, making it actionable. So why would you say it's important for the general public, for their awareness? Why is it important that they do test their telomeres, and especially when they're looking at longevity and optimizing the quality of their lifespan?
So I think it is important increasingly for people in an era of preventative medicine as opposed to reactive medicine. As I said before, we're living now in increasingly in a paradigm where many people are cognizant of the fact that if we want to live and maintain our health, not only into our 60s, but our 70s, 80s, and beyond, we have to be proactive. We have to be prepared to make an investment in our health, right? You can have all the money in the world, you can have achieved many things, but if you don't have your health, really, it's very difficult to enjoy all that other success. So telomeres have been established now based on over 80 years of research, 5 Nobel Prizes of medicine in this field of biology, as being probably the most important factor that regulates our aging process. Telomeres are simply the caps found at the ends of our chromosomes, which are there to protect our DNA in the process of cellular replication. And every time our cells divide, these caps are whittled away, a little bit like the plastic tips at the end of shoelaces. And when those become frayed, when those fall off, the shoelaces can fray. And similarly, our cells can no longer divide correctly and will go into senescence and stop dividing when the telomeres become critically short. So telomeres are effectively like a biological clock. You're born with a certain telomere length, depending on your genetic profile, and then it shortens as you go through your life. But your lifestyle factors, your environmental factors, diet, nutrition, all these things that you work on with your patients can really dramatically influence your rate of aging. And we can now measure this objectively with our technology, because we're the only company in the world. You talked about the gold standard. What makes us really unique, apart from all the accreditations, is the fact that we measure very accurately tens and tens of thousands of individual telomeres from that patient's blood sample at the individual chromosomal level. And that's really important because the telomere length inside the chromosomes is very different by each chromosome. So by able to measure them all, we can get an accurate representation of what that person's overall biological clock looks like. And then we can track it over time to see how their aging process is evolving.
Perfect, thanks. Yeah, I'm following some of the top researchers who are looking at preventing shortening of the telomeres. From my understanding to this point, we don't have the ability to lengthen them, but we can prevent the shortening, which is crucial in protecting the DNA itself, and looking at specific ingredients to help protect the telomeres specifically. So I know you said earlier you're doing some research on looking at the right ingredients based on targeting these telomeres. Can you speak a bit to that?
Yeah, so I mean, fundamentally, the most important thing we need to start with, I always describe longevity and kind of health span as being like concentric rings, kind of like a bullseye, which you're shooting an arrow. In the center, you're always going to have the basic stuff that we all know we should do, but really very few people are capable of achieving consistently, which is having a really healthy diet, not having a sedentary lifestyle, obviously, ideally not smoking, not abusing any kind of substance, drugs and so on. Managing stress. I don't mean not having stress, because nobody in this day and age cannot have some stress, but trying to compartmentalize it, not drinking too much. All those things are really the basic core of any healthy lifestyle. But if you don't do those things, it doesn't really matter what supplements you take, because you're not gonna, achieve a balance. If you're, 100 pounds overweight and you never exercise and you smoke all day and you drink too much, you're never going to find the supplement. If you do those basic things, though, there is a lot of good publications, and you have, of course, familiarized yourself with all this, and we'll talk to this with your patients, around basic vitamins like omega-3s and vitamin D and many standard vitamins that are well accepted and which there's a large body of research, which most people need to supplement their diet. And that's kind of the next level. And then there's this increasing, the further, going further out, you then there's a lot of supplements that have come out over the last few years that purport to maintain, or in some cases even lengthen telomeres. These are mostly based around a extract coming from a plant called astragalus. And I'm sure you're familiar with the different companies that are selling these products. And what I always say to people is, because this is a natural product, it's, the downsides are very few in terms of it's not going to have a pernicious effect on your health. But it's very difficult to assess whether it'll benefit a specific individual or not. There are some products that have done some pretty good levels of research. In fact, we've done some studies for at least one of these companies, and they have some pretty strong clinical evidence that it is effective in a peer study of, say, 100 people. Whether it works for an unique individual is something that you have to try with your own, with your own results. But increasingly, there are companies in the pharmaceutical sphere that are looking at how do we revert aging, because I think increasingly people are understanding that aging is kind of the mother of all disease, right? If you think about all the myriad diseases that people develop over their lives, whether it's diabetes, whether it's cancer, whether it's heart disease, whether it's high blood pressure, all these problems that people have, most of those are really correlated with age. But what we believe is it's more correlated with biological age than chronological age. So you can think about people who are 20 and everyone's sort of relatively healthy, but then as you get into your 30s, 40s, 50s, and beyond, you start getting this diversity of some people who are really healthy, people at 50 who look great, who have the physical energy and skills, when they were, half that age, and other people who already have serious medical problems. Some of that, a significant portion of that, is related to lifestyle and to biological aging. So if you work conscientiously over your lifespan to ameliorate those things, you're going to be able to see that in your test results, and you're going to be able to then choose, what supplements are right for you and how to manage this process.